Hello, my name is Talia Hitt. I'm an assistant professor of pediatrics in the Division of Pediatric Endocrinology and Diabetes at the Johns Hopkins Children's Center. I'm here to tell you about my ongoing work focused on sleep and its effects on metabolism in adolescents and young adults, and my preliminary results from this research. I recently submitted this work to the National American Diabetes Association conference happening this summer. We know that type 2 diabetes in pediatrics is on the rise, and more adolescents are being diagnosed each day. Recent studies predicted that the number of young people with type 2 diabetes will increase 69% by the year 2060. Pediatric type 2 diabetes rates have already worsened during the COVID-19 pandemic, as average new diagnoses per year increased by 77%. We also know that diabetes complication rates are high for youth with type 2 diabetes, and 10 to 30% of the adolescents with type 2 diabetes have hypertension, retinopathy, signs of kidney damage with microalbuminuria, and high cholesterol after only 5 years with this disease. Thirdly, we know the disease of pediatric type 2 diabetes itself can be more aggressive than adult onset type 2 diabetes. And in pediatrics, we have fewer medication options than for adults with this disease. Given the difficulty of treating this condition and high complication rates, we are looking for more ways to prevent adolescents from getting type 2 diabetes in the first place. My research is focused on how certain sleep patterns affect the risk of developing type 2 diabetes in youth. In this study, we have healthy adolescents and young adults wear a watch to measure their sleep for 2 weeks and undergo an oral glucose tolerance test. My preliminary data show that among 24 older adolescents and young adults, those who went to bed later had higher glucose levels 2 hours into the oral glucose tolerance test. In addition, we are finding that those who go to bed later are more resistant to insulin, and also that they have higher insulin levels during this test, likely to combat the higher resistance to this hormone. These findings were all done while controlling for the effect of BMI on the glucose and insulin levels, and they are consistent with the studies that have been done in older adults. We hope to have data on 80 participants by the end of my study. These results are especially meaningful since we noted that the adolescents and young adults in our study overall went to bed late and slept in late, which is consistent with recent studies that have shown that adolescents have been going to bed later across the world since the COVID pandemic started. We have more to learn about this topic, but it is possible that if we can help adolescents and young adults go to bed earlier, this may help reduce their risk of developing type 2 diabetes. I want to thank my collaborators on this work, and thank you for listening.